Welcome to the Deep Dive. This is where we help you cut through the noise, get right to the heart of what's shaping our world. Today, we're plunging into a really fascinating stack of sources. The Observer Group newspapers of Southern California, dated July 2, 2025. We're not just looking at headlines here. We're connecting the dots, pulling out those, crucial nuggets of knowledge. Okay, let's unpack this.
Absolutely. And what's really compelling, I think, about these sources is how they paint such a vivid picture. You've got a nation, a state, kind of at a crossroads. We'll see how these big federal decisions, things like Social Security, how they really intertwine with state level debates. And, civil rights, economic shifts, it all weaves together. It affects your everyday life maybe more than you realize.
Right, and we're kicking things off with a huge national issue, one that touches pretty much everyone. Social Security and Medicare, specifically their financial footing.
Yeah, the timing's key here because the 2025 trustees report just came out. And, well, the outlook is pretty sobering. Let's take the Old Age and Survivors Insurance Trust Fund, that's OASI, Social Security Retirement. It's projected now to pay full benefits only until 2033.
Only 2033. Wow.
Yeah, and after that, recipients would get about 77% of their scheduled benefits.
77%.
And then there's Medicare's hospital insurance, the HI Trust Fund. That's also projected to be depleted in 2033.
Same year.
Same year. And that's actually 3 years earlier than they estimated just last year. Once that happens, it could only pay about 89% of benefits. Now, if you combine the OASI fund with the disability insurance or DI fund, Social Security overall would be depleted in 2034, paying about 81%. Though, interestingly, the DI fund, the disability part on its own, that's projected to be fine, solvent through 2099.
Okay, so those 2033, 2034 dates really stand out. But help us understand, what does depleted actually mean for someone listening? And then paying only 77% or 89%. Is that like falling off a cliff overnight, or is it gradual? I mean, if you're in your 40s, maybe 50s, how should you be thinking about this? Or even current retirees?
That's the critical question, isn't it? Depleted doesn't mean the checks stop entirely, no. It means the reserve funds, the trust funds run out. From that point on, the programs can only pay out what they're collecting in ongoing taxes each year.
Ah, okay. So not zero, but a cut.
Exactly. A reduction for everyone receiving benefits. So for someone planning retirement, yeah, it highlights the urgency for potential reforms. It suggests, look, without changes, your full benefits might not be guaranteed down the road. Definitely impacts planning.
And current retirees face that cut too, if nothing changes.
That's right. Now, the report points to a few reasons why the outlook worsened. There's the repeal of something called the windfall elimination provision and the government pension offset that was under the Social Security Fairness Act. Also, a slower recovery in birth rates than expected, and a smaller slice of the economic pie, the GDP, going to wages and salaries.
Okay, let's pause there. That windfall elimination provision, government pension offset stuff, sounds pretty technical. Can you give us the quick, plain English version? What were those, and why does repealing them affect solvency?
Sure, yeah. Basically, these were rules that reduced Social Security benefits for people who also got a pension from a government job where they didn't pay Social Security taxes. Think some state or local government jobs, teachers sometimes.
Okay.
The idea was to prevent them getting sort of a double benefit, an unintended windfall. Repealing those rules helps those specific workers, absolutely. But it also means more money going out of the Social Security system.
Got it. So more outflow.
Right, which adds to the financial pressure.
And we're already seeing that pressure in the numbers. The OASI fund, as of 2024, held $2.54 trillion. But that's actually a drop of $103 billion from the year before.
$100 billion down. That's significant.
And adding another layer here, our sources mentioned the Social Security Administration itself is cutting staff about 12% of its workforce, which predictably is leading to delays for people just trying to get service, apply for benefits.
Yeah, and Nancy Altman from Social Security Works had a pretty sharp quote on that. She said, basically, today's report is a reminder that even as cuts to the Social Security Administration are wrecking customer service, they are doing nothing to improve its solvency.
Tough situation.
And this leads right into the political fight, doesn't it? House Speaker Mike Johnson has signaled that Republicans have a plan to, as he put it, rein in spending on these entitlement programs. He pointed out that mandatory spending, Social Security, Medicare, Medicaid makes up, 73, 74% of spending, called it on autopilot, which he finds frightening. He committed to tackling that.
But here's the disconnect. The public seems to feel very differently. Our sources point to a recent survey showing most Americans are actually against cuts to these programs. About half said things like, Medicaid and food aid are underfunded. And 6 out of 10 said too little is spent on Social Security, Medicare, and education. So how do we square that circle, the political talk versus what people seem to want?
It's a fundamental tension, and it really highlights the different philosophies on solutions. You have Maya McGuinness from the Committee for a Responsible Federal Budget saying, essentially, any politician without a plan to fix Social Security is failing. Inaction is a choice with consequences.
Right. Doing nothing is doing something.
Exactly. But then Nancy Altman flips that argument. She says any politician who doesn't support increasing Social Security's revenue is, by default, supporting benefit cuts. She frames it as a choice about our national wealth. You know, America's incredibly wealthy. Does that wealth stay concentrated, or does some go towards Social Security benefiting everyone?
That really frames it as a values debate, not just numbers.
Precisely. It's about priorities.
Okay, shifting from national solvency. Let's dig into this major legislative proposal. It could really shake up social programs, both federally and especially at the state level. Our sources mention former President Trump's big, ugly bill, that's Governor Newsom's term, while Republicans call it the One Big, Beautiful Bill Act. Here's where it gets really interesting.
It certainly does. And California's Governor Newsom reacted very strongly, held a press conference called the proposed cuts reckless and cruel and damaging, especially for Californians.
So what are the specifics for California? Break down those impacts, Wes.
Okay, let's look at Medicaid first. That's medical in California. The proposal involves cuts of at least $28.4 billion in federal funding. Billion.
Wow. $28 billion.
Yeah. And that potentially threatens health coverage for up to 3.4 million Californians. Keep in mind, medical covers about 15 million people now. That's over a third of the state's population.
Huge number.
Huge. And specific policy changes add to that, like requiring people on the ACA expansion part of Medi-Cal to re-verify their eligibility every 6 months instead of annually. That alone is expected to kick over 400,000 people off coverage and cost the state $2.4 billion extra.
Just from the administrative churn.
Seems like it. Plus, new work requirements. Those could potentially remove benefits for up to 3 million more Californians. And Planned Parenthood warned this could even shut down nearly 200 of their clinics just in California.
That's healthcare access. What about food assistance? SNAP or CalFresh?
That's targeted too. Proposed cuts range from $2.8 billion to $5.4 billion annually for California. Estimates suggest that could push about 735,000 Californians off the program. And it could shift up to $4 billion in costs onto state and local governments trying to fill the gap.
Those are staggering numbers. But let's talk about the work requirements specifically. What does that actually look like for a person relying on Medicaid? Our sources give us a couple of real-world examples. Can you walk us through those? They seem quite revealing.
They really are. First, there's Stephanie Ivory. She's 58, lives in Ohio. She needs Medicaid for gastro issues and a bulging disc. Makes it painful to stand or sit for long. She's worried just about the paperwork, the reporting. Says, it's hard enough just renewing Medicaid coverage every 6 months. That highlights the practical burden.
Right, the red tape.
Then you have Denise Summer, also 58, from Missouri. She hasn't worked in 5 years. Anxiety, high blood pressure, severe arthritis. She figures she could probably get a doctor's note for an exemption. But her view is interesting. She thinks there's too much abuse in the system, and if others lose coverage because they don't meet the rules, well, that's their own fault.
So very different perspectives, even among people who might be affected.
Exactly. It shows it's not a monolithic view out there. Now, the proposed requirement itself, it would apply to 40 states plus D.C. Enrollees would generally need to prove they're working, volunteering, or in school for at least 80 hours a month, unless they qualify for an exemption.
And the argument for this?
Proponents, like Speaker Mike Johnson, argue it encourages work. It helps preserve Medicaid for people who rightly deserve it, in his words. He specifically mentioned targeting, quote, 29-year-old males sitting on their couches playing video games. And he cited a figure 4.8 million Medicaid enrollees choosing not to work.
Okay, but that 4.8 million figure, our sources push back on that pretty hard, right? With data from the Urban Institute and KFF.
They do. Those studies look at working-age folks on Medicaid who aren't getting federal disability benefits. And they find over 90% of that group are already working, or they're looking for work, or they have a disability, or they're in school, or they're caregivers. Basically, unable to work for concrete reasons.
Only 2% reported just not being interested in working.
Something like that, yeah.
Yeah.
A very small fraction. So the discrepancy is huge. It likely comes down to definitions: who counts as able-bodied or choosing not to work. The data from health policy experts suggests the narrative of widespread unwillingness to work among Medicaid recipients doesn't really match the reality for most.
In the CBO, the Congressional Budget Office, what do they estimate the impact would be?
Their estimate for the House version of this was that the work requirement would cause about 5 million adults to lose Medicaid coverage by 2034, representing around $300 billion in federal cuts. Anthony Wright from Families USA called that figure telling about the proposal's magnitude and harshness.
5 million people. And beyond the numbers, what are the practical worries about actually doing this, implementing it?
Big concerns there. First, the reporting burden. Proving your status every 6 months, maybe even monthly. Critics like Leslie Dock from Protect Our Care point out, what about seasonal workers or people with fluctuating hours? Dock said, if you miss 1 month, you're kicked off. Very unforgiving. And the disability exemption sounds straightforward, but many people on Medicaid have disabilities but don't qualify for federal SSI disability payments. So, as Kevin Corinth from AEI noted, it's hard to know where to draw the line on who is disabled enough for an exemption under these rules.
Have states tried this before? What can we learn from that?
Yes, and the experiences weren't smooth. Arkansas, for example, they had this 10-step online process just to claim an exemption. Even though 30% of people reported health limits, only 11% managed to get a long-term exemption. People described a poorly functioning web-based reporting portal, inadequate outreach, and widespread confusion.
Sounds like a nightmare administratively.
Georgia's attempt was also complex, requesting a modification online, then a phone interview, enrolling in job training before even signing up for Medicaid. And remember, data shows over 1 in 5 Medicaid enrollees do have a disability. It's 22% for ages 1949, jumps to 43% for those 50-64.
So the system needs to handle nuance, but these examples sound very blunt.
Exactly. And Michael Cartman from the Urban Institute, looking back at Arkansas and Georgia, found those work requirements didn't actually boost employment significantly. What they did do was increase the number of uninsured adults, often just because people got tangled up in the red tape.
Which brings us back to what that enrollee, Chris Bryant, said.
Right. People are on Medicaid because they have to have it and have no other option.
Okay, a really thorough look at those federal proposals. Let's shift our focus now entirely to California, starting with something pretty concerning: the state's efforts to combat rising hate incidents. Our sources really highlight this.
Yes, California is definitely grappling with this. There was a key legislative hearing on June 25th, Assembly Select Committee on Racism, Hate, and Xenophobia. The chair, Assemblymember Corey Jackson, put it bluntly. Over the last 5 years, California has experienced the highest rates of hate and discrimination in our state's history.
Highest rates in history. That's a strong statement. What data backs that up?
Well, there are 2 new government reports mentioned. First, the DOJ's Hate Crimes in California 2024. It showed religious bias crimes up 3%, with anti-Jewish bias events rising over 7%. Race-motivated crimes overall dipped slightly, just 0.6%, but anti-white incidents actually rose 15%. Anti-Black and anti-Asian incidents saw small declines.
Interesting shifts there.
Attorney General Rob Bonta stressed the need for this kind of transparent data to understand and combat hate. Then there's a report from the Civil Rights Department, the CRD, with UCLA, called Hate Crimes Across California. Their estimates are, frankly, staggering. They figure about 2.6 million Californians experienced some act of hate between 2022 and 2023.
2.6 million. Wow.
Yeah. And maybe 525,000 encountered hate that was potentially criminal. Another 5 million people reported witnessing hate acts. The CRD director, Kevin Kish, said this makes it clear that hate and discrimination are happening way more often than what gets reported to police.
What's fascinating here is, despite those shifts in specific categories, both reports seem to find one consistent thing when you break it down by race.
You're right. Across the board, the data and community leaders consistently point out that Black Californians experience hate incidents more frequently than any other group.
And it's not just individual incidents, right?
Yeah.
There's a systemic element highlighted too.
Exactly. Rick Callender, who leads the California-Hawaii NAACP, pointed to data from the state's Racial and Identity Profiling Advisory Board, the RIPA board. He noted things like police using force or drawing firearms against Black youth at a much higher rate, 45% for 12 to 14-year-olds, compared to 19% for white youth.
45% versus 19.
And black drivers being stopped 126% more often than expected based on population. It paints a picture of systemic issues, not just isolated events.
So what's the state doing? Are there resources available?
Yes, the state is promoting resources. There's the Stop the Hate program run jointly by the CRD and the Department of Social Services. And there's CaviesHate.org. That's a website and hotline, 833-866-4283 for reporting hate incidents. It's non-emergency and multilingual.
Good to know those resources exist. Now, amidst that tough reality, the sources also bring us a really positive civil rights story out of California. The NAACP California-Hawaii State Conference just inducted two giants into its Legacy Hall of Fame, Dr. Shirley Ann Weber and former state senator Stephen Bradford.
An incredible honor for two incredible public servants. Their impact spans decades. Dr. Weber, of course, is California's first black Secretary of State. As an assembly member, she authored huge bills, AB 392 on police use of force, and the bill creating the state's reparations task force. Just landmark stuff.
Truly historic. And Senator Bradford.
Also a trailblazer. First black person on the Gardena City Council. Served in both the Assembly and the Senate. Key legislation from him includes Senate Bill 2, allowing decertification of officers for misconduct, and the California Cannabis Equity Act. He was also on the reparations task force.
Their legislative records are impressive, but the sources also shared some personal anecdotes that I found really moving. Dr. Weber talking about her parents.
Yeah, fleeing the Jim Crow South, coming to L.A., and their living room became a polling place, her mother baking pound cakes and sweet potato pies for poll workers. It just speaks volumes about where that commitment to civic duty comes from, doesn't it?
Absolutely. And Senator Bradford shared some candid stories, too, about facing racism even in the Capitol.
He did. Being mistaken for security, things like that. But he also shared how calling out the lack of black lobbyists actually led to one getting hired. He joked, "I guess I'm good for jobs." Shows resilience and using his position to create change, even in those subtle ways.
Really humanizes them beyond the titles and bills.
So what were their core messages at this event? And did they voice concerns looking forward?
Their shared values really came through. Integrity. Truth, Dr. Weber emphasized, truth doesn't change depending on the circumstances. Consistency and that deep sense of civic duty learned from their parents. But yes, they definitely voiced concerns about the current climate, a real sense that progress isn't guaranteed, that there's a threat of backsliding.
Like what specifically?
Bradford warned about covert racism being perhaps more dangerous now than the overt kind. And Dr. Weber issued a powerful call to action, especially around voting rights. She said, essentially, we can't sit around and do nothing. People died for the Voting Rights Act, and now they're trying to take it away. We need to be outraged. Wow. Strong words.
Rick Callender, the NAACP leader, summed it up by saying they were honoring Weber and Bradford not just for what they achieved, but how they did it with courage, honesty, and an unwavering commitment to black communities. A call for continued vigilance.
That really underscores the ongoing nature of the fight for civil rights. Even with leaders like them, the work continues.
Absolutely. It shows that progress is fragile and needs constant defense.
Okay, let's round out our look at California with a few other key stories from the political playback section. First, a concerning trend in education.
Yeah, this one stood out. Black student enrollment in California's public schools has hit its lowest point since the 1990s. Now, overall, school enrollment is down statewide, dropped from 6.2 million kids about a decade ago to 5.8 million now. But the demographics are shifting significantly. While Asian and multiracial student numbers grew, both black and white student numbers fell. And Latino students are now the majority in California public schools.
That's a major shift.
It is. And the Public Policy Institute of California says the state's education system really needs to adapt, find ways to serve this changing student body.
Definitely something to watch. Okay, switching gears to a critical justice issue. A call for mass commutations on death row.
That's right. Civil rights leaders are making a direct plea to Governor Newsom. They want him to use his constitutional power to commute the death sentences of all 574 people currently on California's death row.
All 574. That's the largest death row population in the U.S., isn't it?
It is, and a key part of the argument revolves around racial disparities. Lisa Holder from the Equal Justice Society points out that 34% of those on death row in California are black. That's 191 people, compared to about 29% white and 27% Latino. Holder said the racial gaps in outcomes should make you feel outraged.
And this call is happening while the state Supreme Court is considering a related case.
Exactly. The court is weighing a lawsuit from groups like the Legal Defense Fund and ACLU. They argue the state's death penalty law is applied in a racially discriminatory way, making it unconstitutional. Michael Mendoza from Latino Justice framed it powerfully. Quote, "Not a crisis of policy, but this is a crisis of conscience."
Crisis of conscience. That really sticks with you. Okay, let's end this segment on maybe a more positive note. Some economic news for the state.
Yes, definitely a bright spot here. California's Film and Television Tax Credit Program just greenlit 48 new film productions. These are expected to generate about $664 million in spending within the state.
$664 million. That's substantial.
It is. And create over 6,500 jobs, that's cast and crew, plus more than 32,000 days of work for background actors. And importantly, a lot of the independent films will shoot outside of the LA area, spreading the economic benefit.
Good to see it reaching other regions.
Yeah, and the program overall since 2009 has generated nearly $27 billion in statewide spending. It's been a significant driver. Governor Newsom actually proposed boosting its annual funding quite a bit, from $330 million up to $750 million, to keep California competitive.
Okay, so we've covered a massive amount of ground in this deep dive.
Yep.
From the big national questions about Social Security and Medicare solvency, all the way down to specific California policies on healthcare, work requirements, the fight against hate, civil rights milestones, education trends, justice debates, and even film credits. These aren't just separate stories. They're all pieces of a much larger puzzle, these nuggets of knowledge that help us build a more complete picture if we connect this to the bigger picture.
Well, what's truly compelling, I think, is how all these threads, the debates over safety nets, the fight against hate, the push for justice, economic development, they all reflect these ongoing efforts to figure out what is the role of government? What's our collective responsibility for well-being, for equity? It really makes you think, doesn't it? What does it actually mean to navigate a society where these complex challenges and the potential solutions are constantly shifting? And maybe the question for you listening is, how do you engage with these issues? How might you look deeper, maybe locally, through the lens of these bigger trends we've discussed? It's an ongoing conversation.